Hi there. Welcome to the Block Therapy Trauma Relief Summit. If you're just joining us, my name is Deanna Hansen. I'm the founder of Fluid Isometrics and Block Therapy, and I'm being joined by my co-host, Dr. Eric Robbins, a urologist and expert in mind-body medicine, and our very special guest, Dr. Cathleen King. She is the founder of Primal Trust Academy and Community, worldwide platform focused on nervous system regulation, chronic illness, and trauma healing. Welcome, Kat. Now, I am going to pass this over to Eric so he can dive in. He's the expert on this whole thing. So take it away, Eric.
Thanks, Deanna. Yeah, so Dr. Cathleen King, it's so nice to see you. We've been dialoguing back channel. So Dr. Kat has her doctorate in physical therapy. And she, as you said, she's an expert in chronic illness, in chronic trauma, in relationship and attachment repair, which is a big one because most traumas happen in relationship and a lot of times they're also healed in a relationship. She's got advanced training focused on neuroplasticity-based healing methods and limbic system rewiring. And just a little brief aside that the thing that really got me so into mind-body medicine was not even my own struggles, but I have a sister who's 5 years younger than me, who was chronically ill from a very, very young age. And she had chronic fatigue and fibromyalgia. And at one point, her GI tract essentially shut down. She had multiple chemical sensitivities. And we really had decades of dealing with her. And, you know, she wasn't able to get help through the standard medical regimens. And by the way, you know, as you guys know, or may not know, I know, Kat, you know, there's this huge undercurrent of folks that kind of don't even go to their doctor because they're not helped with standard medicine. Huge numbers of folks, and then they come to people like Dr. Kat. And so, Dr. Kat, I think we'll just start with your story because you were chronically ill and bedridden for a long time. So fill us in.
Well, first of all, thank you for having me here and getting to spend time with you and really bringing light to this topic that I'm personally so passionate about. And much like your sister, I went many years with this illness that was so undiagnosed. You know, I mean, at best, they were like some type of anxiety disorder, but can't quite understand why. And yeah, my story really started in my childhood at birth. I was born to a young teen mom who had illiteracy and poverty and no support, no resources. I grew up in a lot of domestic violence and child abuse. And I grew up without being resourced in my nervous system. And I developed a strategy of survival that many of us develop, which is to become a go-getter, an achievement-focused person. I took that route, you know, the white sheep route. My sister took the black sheep route. Same core issue, though, which was just being filled with trauma. But I was very high functioning, and my childhood ACEs score, I had the 9 out of 10 ACEs score. I had the setup for chronic illness, and I knew a lot about the trauma set up with chronic illness in my early 20s when I went to physical therapy school. And I thought, wow, I have survived the odds. The statistics don't apply to me. And right after I graduated from physical therapy school, which my focus was to work with chronic pain and things like that, I started to get sick, especially when I was traveling. Started with kind of a big stressful situation in South America, got the gut infection and my body just crashed. And from that crash, things were never the same. That was in 2003, about 20 years ago. I tried to work for several years. I worked a lot with mind-body issues, chronic pain, all sorts of weird musculoskeletal stuff. So I understood the brain, I understood a little bit of neuroscience, but I wasn't able to help myself because I was not thinking that I had a chronic stress response in my nervous system. I thought I had surpassed that childhood stuff. And within, a handful of years of working, I finally totally crashed. And that's when I had all of the mysterious illnesses that would appear, like chronic fatigue and digestive issues and neurological stuff and sensitivities, and, went from doctor to doctor, and they're like, no idea. I mean, it took me many years to get a diagnosis of Lyme disease and mold toxicity and chronic viral infections. I mean, many years where they would just give me a new form of anxiety medication, basically. And it was so disheartening. And I really didn't see that trauma was the major underlying factor for me, because I was so high functioning before I'd fallen. I went on for many years trying to fix myself with, herbs, Lyme protocols, detox protocols. I did shamans, and eventually I started to like, oh, maybe I should look into my emotions. And so I did EMDR processing and parts work and somatics. And I'm sure that, as part of the summit, you'll be talking about that. And I have a specific message about sequencing of using those things, because despite all of those therapies, I did not get better. I would kind of waver up and down. And I know now a reason why I did not get better. I didn't have the capacity to hold any type of self-regulation. I was always in a state of sympathetic fight, flight, go. And I would go do these different therapies. I'm getting a little closer to the root issue by working on my emotional problems, in addition to trying to address some of the physical stuff. But it didn't hold. It didn't hold because my brain and my nervous system couldn't stay regulated after the therapy session or after the treatment or after the new protocol. And it was so frustrating to me. And then about 6 years ago, I had this big aha moment where I thought, maybe all of my chronic infection and all of this stuff is really, it's really happening in the brain, much like chronic pain. I used to treat chronic pain as a physical therapist. I knew it was regulated in the brain. I knew trauma had a lot to do with it. So I thought, well, maybe I'll start some of my old exercises I used to give my patients years ago. And they started to increase my function. And I'm like, oh my gosh, I've had this skill set this whole time, well over a decade, didn't apply these exercises for the brain to me because I had infection, I had mold, I had all of these other things. I didn't have chronic stress as my root cause, a brain processing disorder. And once I started to implement some of these basic functional neurology exercises, which I will show later today at the end of the interview, so stay tuned, I saw that my brain had a huge amount of responsibility for the Lyme symptoms, fatigue, mold, and processing my emotional state, my trauma. And so I really went down that route of brain retraining, limbic system retraining. Self-regulation was my number one treatment for Lyme disease and chronic illness, and everything switched from there.
Hey, Kat, when you say self-regulation, because it's something when I was studying somatic psychology, I heard the term a million times. What do you actually mean by that at a kinesthetic level or at a body level? What does that mean?
Yeah. Self-regulation is the ability to be aware of what is happening inside your brain and inside of your body. So there's an awareness of your brain state and your nervous system state, your body state. And the second piece of self-regulation is taking personal responsibility to use a tool or a practice to shift your brain state or your body state. That's the way I would summarize self-regulation. So it's both working with the brain and the body, in my opinion.
And then at some point you kind of are in there, you get back there enough where you have a little baseline, like I'm fairly regulated now, I'm grounded, maybe my physiology is more of a ventral vagal state, and you're able to notice quicker and quicker when you're not there, and then you can use these tools to bring you back.
Yeah. And we'll talk about that. We'll talk about the sequencing, I think that's helpful with dealing with trauma and chronic illness, in that you are exercising neural pathways to be able to shift your brain state, shift your body state over and over again, to the point where you reroute your habitual response in the body over time by forming new neural networks. And I'll describe why self-regulation to me is the number one first fundamental thing you do with anyone with trauma or chronic illness. And what I wish I would have done 15 years prior than what I did.
Wow. Wow. And I know you touched on it, but I mean, you were, I think, literally bedridden for what, 10 plus years?
Yeah.
And,
Yeah. I was out of commission. I had
Yeah.
full-time care for my 2 little kids. At my worst, I was in a dark, quiet room because I couldn't tolerate sound or light. Occasionally I could shower, but then I fell out of it for 2 days after, just a shower. I had very little life force running through me, and it was terrible. It was terrible.
Yeah. Wow.
Mhm.
And it was things like, I think, chronic fatigue and Lyme, multiple chemical sensitivity, mold sensitivity.
Mhm.
What else did you have? POTS as well?
Yeah, I had postural orthostatic tachycardia, all sorts of dysautonomia, meaning my ability to regulate my heart rate, my blood pressure, my digestion was just all out of whack. Lots of hormone issues, thyroid issues, severe insomnia. I had a bucket list
Yeah.
of weird stuff.
Yeah. Wow. All right. So you had a bunch of early childhood trauma. Well, an A score of 9. I mean, it only goes up to 10.
And
So,
I'm an overachiever.
you don't go small ever. Okay. So how does trauma affect the limbic system? And
Yeah, let's go into that. And I will share a screen and we'll walk through some things if that's
Great.
okay.
Yes.
Okay, awesome. So we will get into a little teaching here. All right. So we're going to talk about how trauma affects the limbic system. The biggest thing to know is that if you have trauma, it's a response where your brain did not fully process that past trauma event. So what happens in the brain initially, there is an experience of overwhelm that your consciousness at the time, your brain cannot totally wrap its mind around. And what happens is that your memory processing of that event will get impaired. Your limbic system, which is your emotional center of your brain, will get put on high alert for threat because, again, this event does not get processed as being over. So your limbic system, which is this brilliant protection system, stays on alert trying to fix what happened. Your body also gets frozen in the experience. What does that mean? It means the body's stress response doesn't regulate properly because there's not a healthy capacity for self-regulation, or maybe co-regulation did not occur. In other words, the body was not in a state of safety so that it could complete that arousal response of the trauma. So the brain gets stuck, the body gets stuck. And what happens is we end up developing survival patterns. And these are protective, fear-based coping strategies. Really, it's the brain being disorganized and how it's handling what happened. But sometimes these coping strategies can look very functional, like mine did. I became very high achieving and go-getting and vigilant. And sometimes the coping strategies can be more dysfunctional, where you just step out of life and you stay frozen and you don't try. But both of them are an equal coping strategy as a response to trauma. Ultimately, what happens is your limbic system of your brain is stuck trying to resolve the past. And this again takes us back to that memory processing. It doesn't fully process in the past. Your limbic system is still trying to fix something sometimes from 20, 30 years ago. And what happens is the limbic system creates this ongoing stress hormone production of stress hormones to protect you. And often it will cause intrusive thoughts and imagery and fear-based behaviors to motivate you to survive the past. It doesn't know it's the past, but it's really there to just motivate you. So the limbic system is confused between the past and the present. And there's a lot more detail I could go into that, but That's the gist of it. And what happens is the limbic system sends signals to our hypothalamus, which sends signals to our autonomic nervous system. And this whole stress chemistry just floods our body ongoing, sometimes for years. Sometimes we're very functional that way. Sometimes we're very dysfunctional, but that is what's happening. And so a big thing that I work with is I help the brain catch up to the present moment, first of all, and I help people teach their limbic system how to produce calming chemistry into the body rather than just stress. So we're rerouting the brain into the present moment, and we're giving it a new direction to produce hormones of safety and calm rather than stress. And that's the very first thing that I do when I work with people. I want to go into a little more about what happens in the limbic system with trauma and how it can lead to chronic illness. So, like I said, we get this stress response, this fight or flight response is stuck on. The brain is trying to survive, it's trying to protect, it cannot fully process that current threat level accurately. It cannot see the present for the past. What happens when our sympathetic nervous system, which is our fight or flight response, is stuck in on, initially you might have a lot of motivation. You might be, a little bit of a workaholic. You might want to travel the world and do everything. But that on position over time creates a limited ability to fight infections, to detoxify from toxins, and to self-heal. From there, over time, our body starts to overreact to emotional, physical, chemical, or any type of perceived threat. This is where you can have an overreaction to a virus or to a food or to smells and chemicals, to your environment, to mold. You become overreactive in your digestive system. You can get autoimmune illness. Your brain sometimes overreacts to pain signaling. It can't process pain correctly. Ultimately, what happens is our cells get stuck in something known as a cell danger response, which ultimately means that your self-healing capacity is limited because your body is saying, we need to protect, we need to shut down all our resources, and we need to survive right now. We are not in rest, digest, growth, and repair. I personally believe that ongoing chronic illness is a brain processing issue and a nervous system regulation issue at the core, often from unresolved trauma. So when this happens, you can get a host of crazy things that are often diagnosed as anxiety, panic, and depression, PTSD, maybe behaviors of avoidance and codependency, attachment issues, just general hypervigilance, chronic pain, autoimmune issues, chronic illnesses and infections like Lyme disease, chronic fatigue, fibromyalgia, viral infections, long haul COVID, here's a big one, mold toxicity, multiple chemical sensitivity, EMF sensitivity, adrenal fatigue, POTS, dysautonomia, hormone imbalances, detoxification issues, methylation issues, digestive issues, SIBO, irritable bowel. You get the hint. These diagnoses all have a common denominator. And that's the good news. There's a common denominator, which is your limbic system and nervous system processing. And when you can see the common denominator, then you know the most important thing you can put your efforts into, which is to focus on that part of the brain and the body. So, that's a big list. I'll pause there. I will get into the sequencing next if you have any other questions.
Yeah, if you can take off the screen share just so we can see your beautiful face again. So first of all, I just want to thank you so much for sharing that. Like to have somebody go through that kind of life experience and come out on the other side with solutions, to me is truly one of the most authentic and valuable things that we should pay attention to, because you know what's going on, and there's just so many people out there that clearly are being misdiagnosed and approaching things in the wrong direction. So to have your experience and skill level and expertise to assist with people, that's just absolutely priceless. So thank you so much, first of all, for being here again and for sharing this. And I can't wait to learn more.
Oh, thank you.
And I wish they had all this information taught in medical school, because yeah, Kat, I know you can relate. Yeah, I mean, so much what we're taught is that, the body needs medications or surgery to heal itself, and so often those medications are controlling symptoms and not addressing the higher level problem, which really does seem to be a dysfunctional limbic system. I wanted just to make reference to something you said, because like with Lyme disease, chronic Lyme, for example, I think in one of your classes, Kat, you mentioned like in Oregon, like every lumberjack's probably been bitten by ticks every day. They have the Borrelia bacteria in their system, but they don't have clinical Lyme. So, right?
Yeah, absolutely. That was one of my big turning points when you actually test the general population for chronic Lyme disease, or for the presence of the Borrelia bacteria in the bloodstream. Those that spend a lot of time in the woods, they have often that bacteria in their bloodstream, but they don't have Lyme disease. It's the same study as looking at the general population of MRIs of those with disc injuries. There's a lot of herniated disc out there and not pain.
Yeah.
Same common denominator, the way the brain is processing and the immune system is functioning. Yeah.
Yeah. And so we should really be directing really any patients out there watching this, follow what your doctor says, and be aware there's probably a higher level issue, like Kat's saying, that unifies all this. And if you want to heal yourself, start working on stuff like limbic system retraining and ways of shifting the body out of these chronic stress physiology. Yes.
Mm-hmm. Yeah,
Okay.
absolutely. And that's it's so empowering, because it's something you can do, and it's free. You could do these things at home every day. You can learn about them on the internet for free. You can take, inexpensive courses to really understand. It was so frustrating to me that I went to some of the most world-renowned Lyme and mold doctors, and it wasn't until a good decade later that anybody even mentioned my nervous system. Like, they did not treat my nervous system. It's crazy to me. And so I am so passionate to get this out there and save people the hundreds of thousands of dollars and years on their life to just focus on that common denominator, which takes a big leap of faith, because when you get these diagnoses, you're kind of like, well, what about the Lyme, or what about the mold? And, I just want to say, like, you'll be able to take care of that a lot easier when your body is functioning better. You'll be able to handle treatments if you choose to do that, and your body might even resolve it on its own. You're best putting your effort into the one thing you can control, which is your awareness and your reaction to what you're thinking and feeling. You cannot control the populations of these things inside of you, or exactly what your digestive system is doing in this moment, but you can change your autonomic nervous system in this moment. It's so empowering.
So Kat, just a question, and I'm sure you have a variable answer depending on a number of different factors, but can this like literally be in a moment? Can you actually shift that and start to really stabilize and see the progress like immediately?
Yeah, absolutely. And that's what was the crazy mind thing for me when I started doing some of these things to shift my brain state. Literally one moment I'm flatlined on the couch because I can't stand up because I have so much like tachycardia and blood pressure issues. And when I first started implementing some of these tools, I could like stand up and walk all of a sudden. And just before that, I couldn't. And that was just a shift in the brain state. And when you look at, you look at measuring the physiology, just getting into a state of what's known as heart coherence changes the way your heart rhythms are, the way that within a few days of changing some of these practices, your immune system levels change. It's fascinating, it's quick, and it's all about changing the pattern of operation in your brain and in your body.
Amazing.
Mm-hmm.
Yeah.
It's not always easy to do because we have set points and habits of stress and perspectives and stories and we're addicted to stress. It can be rocky to do this, but it does work.
Yeah, and I think you've taught in your courses too, a lot of times someone will have an uncomfortable emotion or physical sensation, and that can also trigger them a huge fear response in response to that, and that kind of puts them back in the fear state again. Yeah.
Yep. And they can get symptomatic. All of a sudden, all of their symptoms are back and they're like, oh no, this isn't working. And I'm like, no, you just shifted your brain state back into stress chemistry. And so therefore all of your old diagnoses just pop back up. Yeah.
Nice.
Yeah.
All right. Let me see. Yeah, I just want to touch on something you had it in your slide, but people can, when the limbic system can present as a bunch of diseases like we talked about, and it can also present as things like multiple allergies. I see patients, they've got this huge allergy list, and they'll have like a urinary tract infection. There's like almost no oral antibiotics we can give them, or these people with like, mold sensitivity where like a tiny spore of mold will set them off. So how does one explain that stuff?
Well, that was me. I was somebody who couldn't even take a drop of a homeopathic without some crazy response. And my antibiotic allergy list is this big too. So what happens is when we get into cellular danger response, I used that term earlier. I'm not going to go into it too much today. You can Google it. But what happens is that our threshold for threat gets very low, where a minuscule amount of substance of any kind can trigger a full-on reaction. The brain is so used to looking for threat at this point that it interprets everything as threat. Anything that even changes your biochemistry, maybe even in a good way. Maybe the antibiotic is helping to, reduce certain infectious populations. But again, that's a change. And the brain's like, oh, this is different. There's some change here. It's so hard because yes, you are actually having a reaction. They're not making it up. The cells are literally like, oh, this is danger. This little bit of mold, this little bit of smell truly can trigger a full-on anaphylactic reaction. And you can change that. You can retrain your own brain and hack the limbic system into perceiving that threat level differently and raise your tolerance for threat.
Wow.
Can we try?
It's all a game of association. I'm not going into the brain retraining here, but it's really simple. I mean, it is about loving that which you're afraid of. And there's a lot of tools you can do to make a new association in your brain to whatever it is that you are afraid of. And you may just start by holding that thing in your hand or thinking about the thing. And that's what brain retraining and limbic system retraining is. It's a game of reassociation.
So Eric, we really do that with blocking and pain. I mean, we make people love pain.
Yeah, exactly.
Cool.
Exactly.
Nice.
Yeah.
All right. So did you have something to say, Dina?
No.
Okay. Katz, you talk about your healing really accelerated when you began to develop this adult main personality. I'd love to hear you elaborate on what that means and how you do it.
Sure. I will go in. Let me go into a little bit of the sequencing of right before the development of the adult main personality, if that makes sense. So then I will get into it. So I'll explain how it fits in. I'm going to share my screen and go into this. So the healing of trauma and chronic illness. As I said, a foundational piece of trauma repair is improving the client's ability to self-regulate their nervous system, in addition to the co-regulation therapies that we often have. In the approach that I use, we often combine nervous system regulation tools with something known as inner attachment repair in a specific sequence, instead of trying to fix the body or uproot a trauma memory too early. And I'm going to go into what that inner attachment repair is in a moment, but I want to go through the sequence a little bit more, how I see it. Now, I'm not going to say I'm, the end all be all right here, but this is from my own experience and working now with thousands of people, what I see being a good sequence and helping somebody through trauma and chronic illness. First and foremost, physical safety is a must. Do they have their basic needs met? Are you in a house? Do you have food? Do you have some basic resourcing? That's important because in order to work with the brain and nervous system, if your existential threat level is being challenged on a daily basis, it's just not going to work. So always making sure that you are in a somewhat place of security as a first step. Then I recommend doing nervous system self-regulation work where you are learning brain retraining, any type of top-down practice where you're learning how to become aware of your brain, your limbic system, and shift your brain state, and also somatic embodiment practices, which are bottom up. Now, this is what I skipped in my process. I did not do self-regulation for many years. I was trying to focus on, kill infections. And I actually also tried eventually doing some trauma processing before I had any capacity of self-regulation. I wanted someone else to fix me, regulate me, do their process. Even trying to do parts work, which is more step 3, too early, was disastrous for me. I had no capacity to leave that office where I was doing parts work and regulate myself. And that is because step 3, I didn't have something developed called an adult main personality. That's what I call it. And this is where I usually work with something known as inner attachment repair, which is you developing the adult that you needed that you didn't have growing up. It's also about discovering yourself. And I'm going to go a little more into this adult main personality in the next slide. But lastly, once you have the capacity to self-regulate a little bit, so these are tools to calm your brain and body down. And once you have developed a little more of a sense of a self that can hold space for you, then eventually we work on integration into the community and giving back. And this is where, it's so fascinating because I can't tell you how many people say, I am so glad I went through everything I went through. Everything. And that is that last stage where you're giving back and there was a meaning and a purpose. And that's why I'm doing what I'm doing. Like I needed to find a meaning with what I went through, and this is it. So I just want to bring this to light because I think it's so important to be mindful of what step you're at. If you have no capacity to self-regulate, it can be really hard to do inner work and to do deep trauma processing or even get out in the world or get into relationship and things like that. So, okay. Finding your inner adult. So a foundational piece of trauma repair is what I call the adult main personality. I often refer to it as your AMP. So what is that? For me, I'd never had a healthy inner adult to come home to. I was trying to do all this trauma healing and integration of parts, but I had nothing healthy to integrate into. I was a scared child trying to integrate into a scared child, basically. And I didn't grow up with a capable, self-regulated adult to even mirror or understand what that could feel like to console myself and to be with me in the disease and the emotions that I was dealing with. So, I had a mentor who said to me, you need to adult yourself. I'm like, what does that even mean? And at first I'm like, well, I am an adult. I got a doctoral degree and I did this and that. And she's like, no, adult yourself, a capacity to be resilient in the face of challenges instead of, Chicken Little, the sky is falling. And that's when I realized why a lot of my trauma healing work wasn't working for me. The adult was the therapist and I was the child, and it was helpful while I was there, and I would leave the office and fall apart over and over and over again. So I had to develop this brain state that is a crucial component of integration of trauma parts and memory repatterning. Your adult main personality is a brain state. It's a physiological state of heart-brain coherence, meaning your heart and your brain are communicating to each other. You're having regulation happen in your brain. Your prefrontal cortex is online. You're in a whole brain state. Your left and right hemispheres are communicating. You are not being run by your limbic system or your brainstem. What happens in this brain state is it's really present moment conscious choice. That's what it is. And it's not subject to the demands of the superego, which is that inner critic, or the unconscious survival patterns, that you have running you. It's this access to this voice that is your conscious self. And I actually believe it's the gateway to superconscious awareness. I think it's a physiological state that literally is the gateway to higher consciousness. That's been my experience. And I have one more slide I want to share that represents sort of what it looks like from a parts perspective. I know you're doing a trauma summit. So what it is to me is the adult main personality is like this big triangle. It's a brain state that's, your whole brain is online, and your parts are understood and recognized by this brain state. Your scared parts, your protective parts, they're not hijacking your brain anymore. It doesn't mean you don't feel them. You're aware of them, but they're not taking over. Same thing with the superego. You might be aware of this critic, this, inner idealized image that has a voice, but it's not the whole of you. It's just an awareness. And you've also integrated your what Freud calls your id, your child, your drives. Like you can feel your drives, but you make choices of how can I meet these drives in healthy ways? So this is just a nice image that I use a lot in my teaching of the brain state we're trying to develop. And we're trying to create this inner attachment between these fragmented parts, and even which really these parts are memory structures and emotions and beliefs and behaviors. We're aware of them, meaning I can feel the part of me that might be scared, but the adult main personality, can feel a sense of trust, even though a part of me is scared. And this is how you move from a survival pattern to a self-regulated pattern. It doesn't mean you don't feel stress. It means that you can regulate in the stress. So
is the adult main personality, is it basically you're forming a big neural network or big neural pathway?
Yeah, it's a neural network of communication, meaning your left and right hemisphere are communicating. Your predominant brain patterning is more prefrontal rather than limbic and back brain. And because of that, your capacity of knowing what's present versus the past is more apparent. Your hippocampus and the other structures of your cortex involved with memory organization are more capable of being like, oh, I'm triggered by him because of when I was 5 right now. And it's like, it's not him, it's because I was 5. You can see that, you can feel that, you can sense past versus present in this brain state. So, all of the tools of brain retraining help to organize the hardware of the brain. And then, the inner work of awareness helps you to just grow this consciousness. And that's really what I work on over a period of several months with people. At first it's just basic brain retraining, and then it's growing this conscious presence over time.
So I have a question.
Go ahead, please.
So as you're turning your child brain into an adult brain, can there be one component of life that that just doesn't catch up to the same level?
Yeah. So I might have all of these parts that are inside this triangle, but you could very well have a few of them linger. I mean, this is our work of our life. We are integrating our whole life. So of course, not all of the parts are here. And that's the work of transformation, of finding and meeting those parts of you that haven't caught up to feeling safe, secure, and trusting of life itself, haven't found how to develop primal trust, which I'll talk about next. Yeah.
Thank you.
Yeah. So yeah, I think, that was my next question. Tell us, you also have this concept of primal trust. So
yeah. So let's talk about where primal trust fits into all of this. All right. So what is primal trust? It's the innate sense of safety in your body and trust in life itself. And let me tell you how I came to find that term. I was in this process of brain retraining and adult main personality development. And I was on the search for a frequency that felt like home and my original blueprint. And one of my mentors, who's a sound healer, was playing one of her new sound bowls. And that sound, the frequency that went through my body was like, oh, that's what I've been looking for my whole life. What is that called? And she said, oh, this bowl is called primal trust. It's the Schumann's resonance. It's the frequency of earth. And I'm like, that. And in that moment, my entire compass, we talked about finding the common denominator. The problem was my nervous system, and my antidote was primal trust. That frequency I knew was the all healing frequency that I had been searching for since I was an infant. That was the frequency I wanted from my mother. That was the frequency I wanted from the providers I was seeing. I wanted to have an innate sense of safety transmitted to me. And ultimately, it was the frequency I was seeking from myself, from my higher self, from source, to run through my nervous system and create a sense of trust, even when I'm, scared, to create a sense of comfort, even when I'm uncomfortable. That's primal trust.
Wow. Kat, you're literally helping people to develop a deep internal body level feeling of safety and comfort. And maybe then just they're almost attaching to themselves to that thing. And many of these people, I mean, I can speak for myself, for many decades, never had that. So you're creating a neurologic state, a biochemical state that they almost may have never had in their life. And you're literally creating that. Yes?
Yeah. I don't think I ever had it. And it's not easy to develop, but once you know what your aim is, and you find moments of it, you know that you can come back there and you can grow it, and it can become more and more familiar. It is a state of heart-brain coherence. It's a state of being in your body and being able to feel all the feels and not give it the meaning that we're programmed to give it to. It's just whole brain conscious awareness and a sense that there's something safe to surrender into, even though we don't understand what it is.
Wow. And so you were able to get there yourself. You kind of understand the map, the pathway. You studied a bunch of different modalities and found out which ones fit, how those pieces of the puzzle fit in that will help you to get from point A to point B. Yes?
Yeah, absolutely. And as a human, I am still every day, I look for my primal trust. We are programmed to fall off from this. So it is a practice. It is a lifestyle. It is what I start my morning with. And I spend a lot of time. I still spend at least an hour a day doing my practices to find me, so that I am at home in my body as much as I can. And so once I got clear on, I'm not just doing nervous system regulation, brain retraining, I am doing primal trust. That has helped me create a map that I think is effective, because I know what I'm looking for. I know the feeling I'm looking for. And I understand a bit of the sequence of how to get there. I mean, I couldn't just go into primal trust. I had to exercise my brain and kind of, it's a workout at first, and I had to tone my vagus nerve. And then I had to go on a search of, who am I and what would my adult think? What do I even think and believe? And had to change my life around a lot. I left my religion, changed my marriage, moved. I mean, it was like transformation central. But this feeling, that sound that I heard and felt in my body, I was like, that's it. That's what I need. That's what I need to self-generate.
Like you know now. And again, then you also know when you're not in that state, and you probably recognize it a little quicker each time, and you're able to do what you need to get back there.
Yeah, absolutely. I mean, there's things that can trigger, relationship stuff or work deadlines. And you're like, okay, I'm out of my primal trust right now. I've got to go do the things I need to do to run that frequency back in. But what's so cool is that the capacity to come back into alignment is quicker and quicker. I mean, years ago, it would take me days or weeks to recover from a setback. And it's like, if I get out of balance and my nervous system gets out of whack, I mean, it can be minutes to recover. And that is freedom. It's freedom. It's not getting out of whack. It's, I can come back into alignment.
Wow.
That's beautiful. Wow. Thank you.
All right.
I just feel calm listening to you.
Yeah, I know.
Primal trust is right here, just listening to Kat.
Yeah, we've had a few of these interviews, and you can tell the people themselves are really regulated, and they can they're a big neurologic container that can, help kind of bring other people down, and that's important too. Just like that bowl, I think we ourselves can get to a certain point where we can help others co-regulate, and then at least they kind of have a little bit of a baseline. So, all right, did you have some tools you wanted to share?
Sure. Yeah, let's do one without the slide and then
Okay.
the other one with. So I'm just going to share with you some basic eye exercises, and they seem like, what? Well, what if my vision is fine? This is not about your vision. It's about improving brain processing. And these were some of the first exercises I did to start with that first part of the sequence, which I said was top down regulation and bottom up. This is called functional neurology eye exercises. You can also call them eye yoga. And the first one we're going to do is called eye gaze stabilization. And what this does is this helps to send the signal to the limbic system that you are safe enough to focus on a point. And what happens is when we're in stress, our eyes actually dart around quite a bit. We're kind of always looking. We're not able to focus very well. So this helps to retrain the brain to focus. It also triggers the vagus nerve, and it also works on our upper cervical alignment, which has a lot of feedback loop into our midbrain and affects our nervous system a lot. So it's great if you're somebody who deals with spinal pain, and especially neck pain. But even if you don't have neck pain, I didn't have neck pain, but it was really helpful in getting my neurology to get a little steadier and starting to tone my vagus nerve, which is part of our regulation. So I'm going to teach two exercises. One of them is called eye gaze stabilization. Another one is not one of my exercises. It's an exercise by Stanley Rosenberg called the basic exercise. And I'll teach that second. So the first one is very simple. You're going to put your thumb straight in front of your nose. You're going to look at your thumbnail. You're going to take a deep breath in. And as you exhale, you're going to stare at your thumbnail and slowly nod your head side to side. Do not move your eyes off your thumbnail. Exhaling as you go. And pause, inhale again. Focus on the thumbnail, and as you exhale, nod. Focusing on a single spot, back and forth. Nice and slow, don't do it too fast. And again, one more time, inhale. Focusing, nodding. Your eyes are connected to your brain. You're engaging your left and right hemisphere while focusing on a common point. This is bringing your prefrontal awareness online and balancing left and right hemisphere a little bit as well. And also triggers your vestibular, your oculomotor system. So there's a lot of little things that happen. You can do this with putting your thumb in different positions. You can move to the side, above, below, as long as you hold steady and nod back and forth on the exhale. You might feel a little dizzy. You might feel a little bit of funny feeling in your head, totally normal. It's just your brain processing, sending, messages. I recommend doing that simple exercise, maybe 3 sets of 10, couple times a day, up to 4 times a day. If you get symptomatic, which a lot of times when we are in trauma, our brain gets stressed when we focus on something. It's like, no, we got to keep vigilant. You can have a stress response. It can make you feel dizzy and out of whack. So just do 3 repetitions and then let it be. Start to teach the brain that it's safe to just focus for a little bit and be still with your gaze. So any questions on that one before I move on?
No, but just like you said, though, it's the finger can be in front. You can also raise it up and do that.
Yeah.
And down. And you're also getting these extraocular muscles that frequently are just very fixed in one place. I know people that are used to feeling bad and depressed, they're very good at kind of looking down all the time. We're always looking down at our cell phones. And so even stretching those muscles to be able to go up, I mean, this seems, as you said, so simple. It's extremely powerful,
Yes.
working the eyes and developing new neurologic pathways. And it can feel a little scary or bad to some people, but
Yep.
it is one of the ways. Yes.
Yeah, think of this as just your first physical therapy strengthener for your brain limbic system. Our eyes are connected to something known as our vagus nerve, and the way that we look with our eyes has a lot to do with our ability to actually be courageous, to be connected. You're sending signals to your brain that you do have the capacity for courage and connection. So yeah, I actually have a slide to share a little bit of that. I'll do that real quick now that I'm done with the demo. So like I said, it's a simple biohack, and there's a lot of eye exercises out there. I teach a lot of them in my program, but if you're really curious, there's a very affordable program that teaches a ton of them called Z Health. I'm not affiliated with them in any way. They have a lot of eye exercises that they do for sports retraining, Z Health. But they're actually great for trauma and chronic illness. And I use them all the time, in addition to some that I have inside my program. So you are activating your vagus nerve, you're decreasing your stress response, you're communicating messages of safety. It creates the neurochemistry of courage and connection, helps you stay present in the face of danger. They are calming and regulating over time. You may have an initial spike in anxiety, and that's normal because you're actually you're moving out of freeze into activation. And so it's okay if you have a little spike, just exhale calmly and just keep doing them to tolerance, and you will improve. Very shortly, I was able to improve my capacity for light, for sound, and for driving, doing these alone without even doing brain retraining. I just did eye exercises for the first month of my brain rehab, and I had a radical shift. So yeah, very powerful stuff. The next one is from Stanley Rosenberg, Accessing the Healing Power of the Vagus Nerve. It's a book. I highly recommend it. He's got a handful of exercises in there. This is one I use a lot because it's very effective. It's really great for helping people with anxiety, with chronic fatigue. I do this even with my kids, any type of like sensory processing, autism stuff. Super simple exercise. And typically you do it laying down, but I'm going to show you sitting. Because it's typically done laying down, do it first thing in the morning. It's a great time to do it. You're still laying down. And basically, if you're able to, are you able to see me while I share the slide, or should I stop sharing the slide so they can see me?
Stop sharing so they can
Okay.
see you.
Stop sharing.
Okay. All right. Okay. So it's super simple. You are going to put your hands together like this, clasp them, put them behind your head. So if we're laying down, we would just be laying down, but we're doing it sitting up. I do it sitting up all the time, so it's okay. And you're just getting a little pressure back here. So you're just stimulating a little bit of your cranium and where the nerves run through your occiput right here. So that's just for stimulation purposes. Second thing, you are just going to look with your eyes as comfortably as you can all the way to the left. Find something to hold your gaze on and stay still. Now, keep your chin facing forward. You don't turn your head, just the eyes. That's really important. Keep your chin forward, eyes to the left. And you're just going to hold this. You're going to hold your gaze and focus on a spot until you feel a yawn or a sigh come over you. And if you don't feel anything, just try to hold this for about a minute, maybe 2 minutes at most. You might not yawn or sigh at first. I'll explain what that is in a moment. So we're just going to hold this gaze. You can just breathe comfortably. You could even just take some nice relaxing breaths. Just focusing. Once you yawn or sigh, just simply look back to the center. So now I'll just wait. So we'll just be back in the center. You're going to feel a little dizzy, totally normal. It's blood rushing to the front of your brain. So we're flooding our brain with some good blood supply. We're also adjusting our C1, C2 vertebrae here. So it can be a little bit of sensation. So now that you're back to center, look to the right as far as you can comfortably. Hold your gaze, same thing, for up to a minute or so, or until you yawn or sigh, and then you'll return to center. This is triggering your vagus nerve, your cervical vertebrae, and just helping your brain come online a little bit more. And just when you're ready, coming back to center, you should feel a little dizzy. That's why they usually do it laying down, because you get a rush of blood right to the front of your head, and it can feel a little funny. Okay. So that's it. Super simple. Ideally, you do that a few times a day. If you're, he actually recommends 4 times a day in his book. I find that people, see, I still feel a little woozy. It's totally normal. I have a lot of clients that'll do this pretty consistently for a week or 2, and they'll find that their energy level really shifts, because it's just changing the way that the autonomic nervous system is functioning. So 2 very simple exercises that have a big impact that you can get started on to help, improve the processing of your brain.
Those are both just awesome. Yeah. Wow. Kat, thank you so much. I'm so glad you taught those, because I've done them, and they're enormously, enormously powerful.
Mhm.
I always say, like, when you wake up in the morning, like, how do you know who you are, and with all your problems and the stuckness? And that's these deep neural pathways. And there's so much else to life, but we have to, it's like being in a big field and there's that one well-trodden path, and we know that well, but you're helping create new neurologic pathways for feeling different and better, and
Mhm.
calming down the nervous system and the limbic system. And
Yeah.
wow.
Yeah.
Oh,
Yeah.
wow. Thank you so much. That was just fantastic. Amazing information. Again, just listening to you, just your presence is calming. So first of all, anybody that is on these calls, I think they're going to, again, just resonate immediately, because your story and your approach to everything is so systematic and simple. And that's what the world needs now, is simple approaches that can make big impacts. So thank you so much.
You're
Yeah.
welcome.
All right.